any of you have experienced it too. So if we get booted out or freeze, just bear with us. We'll definitely try to pick up from where we left off. Next slide. This is today's agenda. We're just going to be going over some updates, flu clinics, open enrollment, and then we'll jump into the returning to work piece. Next slide. The updates for well-being at work is that we had the overview training last month. Thank you for attending, for those who attended. We are starting our check-ins with you, so please look out for those calendar invites. And we'll be discussing the annual plans. We are having still virtual well-being offerings available. So if you have some ideas and activities in mind and programs in mind that you want to offer for the rest of this year, please put in the request. And please save the date. We are having a virtual award ceremony for all of your efforts through the past 2 fiscal years. It is the date is November 17th at this time. We also ask that you update any flyers that you have posted around your building that might have our old number. We have changed our number. The area code is a 628 now. So any flyers that you see with a 415 area code, please remove that. And if you need a replacement flyer, please reach out to us and we can get you that.
And just a quick call out, this is especially important for the EAP flyers that are up at your workplaces, because we want to make sure that people aren't frustrated when they try to contact for immediate support to our employee assistance program. So if at the very least you do a quick scan for EAP, that's top priority.
Okay, so let's jump into the flu prevention campaign. Every year, October is our date when we start kicking off the flu prevention program. We do this by educating our members and staff. We also offer on-site clinics, so it's ease of access to a free flu shot. And we also provide a lot of information about how you can prevent from getting the flu, and also if you are not coming into the city right now for work, and how you can receive a free flu shot through your health care provider. We will have safety measures in place at the worksite flu shot clinics. We definitely follow the recommendations from DHR and DPH. We will have signage, and anyone that shows up for a worksite clinic, you do have to do the self-certification online. We will have, everyone will have to wear a mask and hand sanitizers in the various tables at the clinics. Go ahead, next slide. So these are the scheduled clinics. We have 23 scheduled clinics throughout the city for employees, and a few that are outside of the city. We do have open and restricted clinics. And when we say open, it means any employee, any retiree of the city, and any retirees, dependents, domestic partners, and spouses can attend a open clinic. Restricted clinics just means that they are closed to the public. They are only available for the employees who have access to those buildings. So please keep a lookout for promotions for the open and closed clinics if you are at one of the departments that are hosting one on site or restricted. And we will have appointments just like last year, and I will walk you through what that appointment system will look like. Go ahead and go to the next slide. So who's eligible for our flu shots? Employees, retirees, and the spouses and partners of retirees from the 4 employers. So we don't provide flu shots for dependents, meaning children or anybody that's part of your health plan, or for employees. So employees, please don't bring your children. We ran into a few of those last year at the flu shot clinics. The worksite clinics are only for active employees. If you are interested in getting a flu shot for your family and your dependents, employees, please look on our website for information on how to get one through your healthcare provider. Go ahead, next slide. So these are just some of the roles that we walk a host through or a champion through. If you're a clinic host, we basically reach out to you to secure a location, to secure a date and time. You attend the planning calls, and you are the contact for the flu clinic nurses when they arrive. You also make sure that the room is set up and ready to go before we arrive, and are there to kind of help with breakdown if needed. If you are a champion at a clinic where it is hosted at your work site, we just ask that you help promote. And I have already reached out to a few of you to volunteer. And if you are still interested to volunteer at any of the listed worksite clinics that I showed early in the earlier slide, please reach out to me. We are still looking for a few volunteers to do 1 to 2 hours per clinic. And all champions, just please promote, raise awareness, communicate about how people can access a free flu shot at a worksite clinic or through their healthcare plan provider. Go ahead. So these are just the communication timelines that we have scheduled out for the citywide emails. As you can see, there was one that hit last week and one that went out yesterday. And then we always have a last call just to remind people it's not too late. Go ahead, next slide. These are the promotional materials. I'm sure some of you have already seen them. These are the flyers, the site-specific flyers. The flyer in the middle is showcases all of the open clinics on how to get how to make an appointment for an open clinic. And then we also always have a retiree educational flyer that we send to our retiree population. Go ahead, next slide. This is the online information, so please visit our website for more information. You'll also want to drive employees there if they have any questions. It's a great place to start, so please go there to check it out afterwards if you haven't already done so. And then we are using Microsoft Bookings for appointments. Most locations are requiring appointments. There are a few that opted not to. But I just wanted to call out for Microsoft Bookings. When you click on the link and you go there, you have to scroll to the date of your clinic date, because it will show, for example, if you go there today, it will show automatically September. But if your clinic is in October or November, you have to scroll to that date of the clinic to find the appointments. Go ahead, next slide. This is just a slide of additional resources for you if you're interested on sharing these resources with your employees and leadership, or maybe you have a newsletter that you want to add some flu prevention information in there. Please visit these websites to learn more about how to prevent the flu. So open enrollment is around the corner. Every year it's in October, but this year the open enrollment period is from 10/1 to 10/29. HSS is hosting 18 live webinars, as you can see right here. There are different dates, different times. Please promote these webinars. I think that they are going to be very informative and will help navigate staff on how to elect their benefit for the upcoming year. And not only are we having talks about about the different health plans, we are also having different topics. For example, starting a family, mental health support, FSAs, if you want to learn more about that, staying healthy. So these are great resources for your members, for us as employees of city and county, to learn about all the availability benefits through these different topics. There is an online website, and it will go live next Monday on 9/27. So if you have any employees who are curious of any of the new benefits, please point them to that website. We also have an online calendar that is only dedicated to open enrollment and flu shot clinics, and the link is provided there. We did a video. I'm not sure if any of you have seen the open enrollment video. but that is a great resource on just kind of giving, it's a cute way. We had city employees' children be part of the video to just showcase about the importance of open enrollment and why people should definitely pay attention to their benefits. Next slide. We are having a raffle this year during open enrollment, and these are the different ways that a person could win. We will have flyers at the flu shot clinics to help showcase and promote the raffles. And if you are interested on what some of the prizes might be, please email us and we can definitely share with you. Go ahead, next slide. Okay, so flu shot prevention next steps. Please raise awareness, promote now, promote these clinics and all of the resources that I went through today. And if you're a host, please attend the planning calls. We are still having them in October to go over the logistics of hosting a clinic. And all of the resources that I went through today will be posted on the Wellbeing at Work training website after. Thank you. That's it.
Thanks, Lisa. I know that was a lot of information, folks, so please keep a lookout for a follow-up email from us, which will also reiterate some of this information. We're also creating a web page that we'll be sharing in that follow-up email with all of the flu information. So hi, I'm Irene Umipig. For those champions that may be new and for all the returning folks, it's great to reconnect with you again. This section of the presentation really shifts us to looking at how we reintegrate ourselves and how we support one another as we move through this new transition of reintegration. And the presenter that we have today is Jeanette Longton, who I'll be really excited to present in just a second, but she's going to talk a lot about how we can support each other and why it matters that we provide that support through this transition. Because during the pandemic, we've all gone through a diverse lens of experiences. We have some workforces on the call today that went 100% remote, some that continued to function as essential workers, and others who were activated to become DSWs. We all supported the city's pandemic response, and we all have a varied experience in how we reintegrate back to work and with our colleagues. So today's training really focuses on the importance of being intentional about how we reintegrate and what we can do to support one another in this next phase. So really quickly, when we're talking about supporting employees through transition, what we have found in anecdotal conversations that we've had with many of you, as well as some of the department leads that we've been talking to, is that the stressors that are associated with returning to work boil down to health and safety, social interactions, and then the uncertainty in reintegration. When we think about health and safety, what we're really talking about is that your employees have lots of questions about concerns in reintegrating. And, you know, it's not needless to say, there's a lot of mixed information in the media as well, and it's a moving target. Things continue to change. So the most important thing about health and safety is that you communicate early and often and understand that everyone will have different needs and concerns. Especially with health and safety concerns, it's important to be clear and to address all concerns to the best of your possibility. If you don't know the answer, because it definitely is not your job to know all the answers, it's important that you extend yourself as somebody who can help folks to find the answers. And then if you're a champion, you could reach up to your department lead for support, or you can always reach out to Department of Human Resources for support as well. The second piece that comes up when we're talking about uncertainty is social interactions. And this is how we all need to reflect on what employees appreciated most during the pandemic and ensure that you don't take away the pandemic support that you've already been offering. So if you're virtual and you're transitioning to hybrid or going back to in-person, you know, how do you support those employees the same way that you did when you knew they were going through a transition back then? Think of this as an opportunity to level up, as we always ask you to do so, and consider what virtual options you'll continue to have available as you move towards a hybrid option. And then uncertainty and reintegration is about really just workplace reentry and the disruption and change that may cause for folks. Employees took on added stress during the pandemic, and reentry and reintegration will be similar. So asking lots of questions about what uncertainties resonate most with employees is going to be important so that you can properly address that uncertainty, since every person is going to have a different experience. So when we think about supporting the employee as a whole person, which we always ask you to do when you think about well-being, we ask you to take the following considerations in mind. So the first is that there's a varied experience. As I said, lots of people did lots of different things to support the pandemic response. We actually created this fantastic, I have to say, return to work guide for those of you that have DSWs or who have folks that have gone 100% telecommute and are going back to hybrid or back to the workplace completely. I strongly encourage you to take a look at that document because it gives you some really simple tips that can be implemented. We have two versions of it, which I'll be highlighting later. One is for them supporting employees and as a champion, and the other is for department leads and something you can share with leadership. The second is emphasizing support resources. So really important that you give permission to practice self-care. Be clear about the resources available and that they should take care of themselves. I talked about over-communicating. Communicate often and transparently about well-being resources, tools, and programs. Ask for feedback. This is where your champions can really come into play because champions are bumping elbows with folks and they can have those day-to-day conversations to say like, how's it going? What do you need help with? I've sent out this email. What resonated with you? And so that sort of anecdotal feedback is really important because then you can reframe how you approach wellness and supporting employees. The other thing that I want to emphasize is that we ask you all to just lead by example. This is really important, especially for the department leads that are on the phone call, that you get involved, that other leadership get involved, because if leaders are doing this, if they are the ones that are reminding employees that they have to practice self-care, that they have to take their breaks, that well-being is important to the core values of the department, and that taking care of the employees is important during this transition, it will really make a positive impact. It's an opportunity for all of our departments to set a new precedence. And so I pose the question, how will we move forward with well-being and supporting this new transition to all of you? With that said, I also want to share some preliminary because we have 400 paper surveys that we still have to enter. This is preliminary data from the Beyond COVID survey that you all supported us to promote. We had over 6,000 participants take part in this survey. That's about 22% participation citywide, which is 4% higher than the previous COVID-19 survey that we had. And we're really excited because 37 departments met the 20% goal of participation for their total employee population. And for those departments that met the 20%, we are then able to generate a department-specific report for you in regards to the data collected. So take a pause because we are entering those paper surveys, but we will be reaching out to you to share some of that data with you. The chart that you see on this slide specifically shows the stress score that we found from the preliminary data, and it basically shows that the average stress score was at a level of 6, which is right in the middle of the spectrum. This is the most important data, and it's most relevant to what we're talking about today. Individuals that strongly agree that they had regular check-ins with their manager or had a support system for their emotional well-being when under stress reported a lower perceived stress score as well as an overall stress score. And so when these folks that have the support system were compared to those who answered that they disagreed or that strongly disagreed, you see that the stress score changes significantly. So in that first row where it says the average stress score, for those who had a support system, the average stress score was a 5. For those who didn't, it was an 8, which is a 46% increase. Similarly, in terms of perceived stress, the average score for those who had support was 19, and then it goes up to 29 for those that did not. So again, that support that we offer during this transition can significantly impact employee morale, employee engagement, and employee well-being. So before I introduce our presenter today, I'm going to take you through a series of resources which will be posted on our website. The first is the Return to Work Guide that I previously mentioned. So this is the first page, which is a tool for supervisors. This is a second page, which is a tool for employees and can be shared widely. It can just be shared as is. You just send it out. This next tool is something that was actually created for a lot of the departments that had DSWs, but very relevant to our next transition. These are resiliency and support visual reminders. So you can print them out as PDFs, or you can get them up on your digital display, and they're rotating messages with resources, self-care reminders, and then resiliency reminders that continue to encourage folks to support one another through the transition. And then the other thing that I wanted to call out, as always, is our employee assistance program. They are available. There's information on this slide about what you get when you contact employee assistance program, the contact information. And again, we do want you to go and do a quick walkthrough at your workplace to pull down those old posters, because as you can see here, the number has changed for people to access this resource. And then this slide is also available for folks. It has some really fantastic resources. I think a lot of people have been using their mobile phone even more during the pandemic. And so really focusing on these online-based applications and websites is going to be a really great resource that you might focus on in your next newsletter or next well-being shout-outs. And then without further ado, I am so excited to introduce Jeanette Longton, who is one of our employee assistance program counselors. As you can see on this slide, she has 36 years of experience as a therapist. She's done management consultants and crisis response support. Jeanette works with all levels of employees as a counselor, consultant, coach, facilitator, critical incident responder, and workplace mediator. She does trainings for us. She's actually developed a lot of the wonderful resources that we give to our workplaces. And she is a liaison for the first responder departments to our external EAP vendors. And so without further ado, I will pass it on to Jeanette.
Thank you all for being here. And, you know, Irene talked a lot about reintegration, which I think is an absolutely, you know, stellar word to use, because it really is reintegrating into the new normal of our workplace. And what's really important to take note of for those individuals who never left, who never did remote work and continued to be frontline workers, first responders, et cetera, it's really important also to acknowledge that they have a whole different set of stressors. And I'm just going to make a really quick shout out on that for our stress first aid training that we're doing. So Irene or whoever's advancing the slides, go ahead and go to our next slide. So our ever-changing new normal. So, you know, I went for a word cloud on this, and the thing I like about it is it says post-COVID world. And the reason why I like it is because it's really in our face, and the reality is there is no post-COVID world, right? So it is, whoops. Are you hearing me still? Because now it's telling me I have bad quality again.
We can hear you, Jeanette.
Okay, all right, good. So there is no post-COVID world. And what we find in the new normal is an ever-changing relationship with what's going on in the world. And that can cause, a lot of people are feeling pandemic fatigue. There's changed relationships. There's reluctance to do things, maybe even, go back into the workplace or do things you would normally do at work. There's mistrust, fear, the Delta variant, mood variant. So there's a lot going on that is really impacting people's emotional well-being and their ability to be resilient. Next slide, please. So we have to figure out the new normal. And what I mean by new normal is that it's ever changing. It really can be moment to moment, day to day, week to week. So we have the impact of work experiences. So those who have continuously worked on site, they have a whole set of experience. DSW deployments, those individuals have another set of impact. And then the remote work, some were on furlough, so it could be paid or unpaid leave. People have been out of their comfort zone. People have had trauma experiences, and that can be around work-related issues and being thrown into a DSW position that's out of your comfort zone, to being a frontline worker or first responder who is thinking twice about the things they've just always done, right away, that they're thinking about, oh my gosh, am I going to bring COVID home to my family? So there's also a sense of accomplishment for the wonderful things that so many people, that really all of our city workers have done to keep the city going. And then we have the anticipation of new experiences, and that can wear on our emotional well-being. So whether it's the commute, the new variants, expectations, thinking that we're going to get back to pre-COVID, guess what? That's never going to happen, because this is a new world. We're always moving forward. And the idea of equity and never-ending stress. So the impact of home experiences are things like school for people with kids. Families have changed. Work-life balance has changed. Our pets have changed. My dog keeps on jumping up on me, so I'm glad I'm not on camera right now because she wants attention. Social life changes, and again, the commute. So in anticipation of our new home experiences, we're thinking about, how are we going to get kids to and from school? What is it going to look like to get back into the idea of, having to rush home, get homework, get dinner on the table, all these different things. I'm thinking about pet care. So there's a lot to be thought of in our new normal, and that can cause a lot of extra stress for people. And what Irene said that I think was so important is that each individual is different. Each individual actually comes into the workplace with their own life experience, past and present. And so that's where we, kind of think about trauma-informed care. And in fact, we have to see each individual as an individual. And so we're going to get more into how to do that. Irene, can you move forward? So excellent communication is absolutely key. And I love that Irene said communicate, 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 and over communicate. And that she also talked about being a role model, because it is so important that as champions and as department leads, that you are role models for your employees. Next slide, please. So when we talk about communication, I'm going to go over it a little bit with you today, because we have an exercise about listening. So communication has three main components. There's verbal, that's what you say, that's only 7%, so that's not a very big percentage. And then we have paraverbal, that's how you say it. and that's 38% of our communication. And then a whopping 55% is our body language, and that's the nonverbal communication. And with the nonverbal communication, it's not only really important to be aware of ourselves and how we're coming across with our body language, because an eye roll can happen in a flash, and we might not even notice we're doing that. Or some head language, moving our head, or, you know, the way we're crossing our arms or looking at somebody when they're saying something to us. Really also important to keep in mind about body language and connecting with others is cultural cues. So different cultures have different tolerances for different types of body language, and in fact communicate with different body language. So whereas, you know, a teenager might give you the head wiggle to, you know, indicate that they think you're full of it, you know, somebody from another culture, whoops, I'm getting some feedback here. Okay. Somebody from another culture, it may just be a way of communicating they agree. So let's go ahead and move on to the next slide. So I would argue that communication has a fourth component, and that fourth component is in fact listening. And listening encompasses verbal communication, paraverbal communication, and nonverbal communication. So we're listening with our ears, but we're also listening with our eyes. And I would also say that we should be listening with our heart and our soul, so that we can really hear where people are coming from. And their experience may not be ours, but if we can listen to them with their point of view in mind, that is an absolute gift to the person who is talking. Because bottom line is this. Next slide, please. The bottom line is this: we all want to feel heard, understood, valued, and validated. And the way we can do that is with excellent listening. So listening is how you take in information, right? And I mentioned you take it in with your eyes. So if you're having a conversation with somebody and they're saying one thing but are communicating another with their body language, great opportunity to stop the conversation and say, hey, just want to check in with you because you're saying this, but yet you're looking a bit upset right now by the look on your face. Is there something else that you're wanting to say? So giving a person the opportunity to be true to themselves and to you in what they're communicating. So when we teach listening skills through EAP, we're using a lovely acrostic called RASA. And RASA is a Sanskrit word. Sanskrit is the most ancient language known to mankind. And the Sanskrit word for essence is rasa. And rasa is the essence of good communication. So we receive what the person is saying. We appreciate where they're coming from. That's the trauma-informed point of view. We're summarizing what we've heard. So we're kind of saying, this is what I think I'm hearing. Is that accurate? And asking clarifying questions to ensure our understanding of what the other person is saying. So RASA is receive, appreciate, summarize, and ask. Next slide, please. So again, as I mentioned before, a primary need for all of us in communication is to feel heard, understood, valued, and validated. And your goals as the listener are to show that you're hearing, to show that you're understanding, and to show that you value what they think and what they feel, even if it's not your own point of view. And to attend to all aspects of communication. And that again gets back to what I was saying by if somebody's saying something and it's incongruent with their body language, then it's your responsibility as listener to create a space for that person to speak about what is really truly going on for them. And, you know, that needs to be a safe space. So again, that gets back to, you know, validating and valuing another person's point of view. And most importantly, you want to quiet your own thoughts, because how many of us, we've all done it, we all do it, are thinking about how we want to answer or how we want to solve another person's problem before they even get their sentence out of their mouth. So our goal as listener is to quiet our own thoughts and use the RASA model to help us do that. Next slide, please. So let's go ahead and take some time to practice this important skill. Next slide. So we're going to be going into breakout rooms of 2, and you're going to have opportunity to practice listening with RASA. And Lisa is going to put the this PDF in the chat, so you can open it up. And these are your instructions for the breakout rooms. You're going to have 1 listener and 1 talker and 2 rounds of 3 minutes each. So both of you are going to have opportunity to talk and to practice listening with RASA. Talker, you're going to talk about something you learned. It could be a skill or something you've learned about yourself during the last 18 months of the pandemic. Listener, you're going to use RASA to practice being a good listener. Next slide, please. So talker and listener tips. So talker, sometimes emotions can get triggered during these exercises. So I'm going to ask you to play it safe because we don't have a whole lot of time to do this exercise today. Stick with the subject matter that's not going to be triggering for you. And do not expect to get a problem solved. Your partner is going to practice being a good listener. And listener, resist the desire to jump in and solve a problem and think about compassion versus solution for this exercise. Listening can be enough. And so let's go ahead into our breakout rooms, and you have the acrostic below: receive, accept, summarize, and ask. And Irene, go ahead and help us get into our breakout rooms. We have like 2 minutes to ask a couple of questions, and I'm going to ask, you know, just 3 people to unmute yourself and respond to how did it feel to be listened to, and what were your biggest takeaways from this exercise, or do you have any other thoughts? So just popcorn style, just go ahead, be brave, turn on your mic and quiet group. Okay, so Xavier.
Yes, hi. This is Xavier from DCYF. I think I just realized just how important it is to at least make the space available for listening, because I noticed when I was talking, like, it gave me a chance, knowing that this other person was going to receive, appreciate, do the whole RASA thing. Like, it made it easier for me to actually take the time to kind of reflect. And just having that time and space to reflect on what I've learned in the last year or so about myself was also also very healing in the same moment.
Thank you for sharing that. Anybody else? About one more brave person.
Hi, this is Carlo.
Hi, Carlo.
Hi, my partner was Elizabeth, and I want to echo what Xavier just said, just to create a space, a safe space. It's funny what we were talking about in just the short amount of time, me and Elizabeth, we were talking about family and what they meant to us. So yeah, it made me realize that sometimes you just have to put your tasks aside and just be present. So for me, that's what I got.
Yeah. Yeah, thank you for that. Thank you for that. So I think that's a real good segue into the next slide. So can you go ahead and advance? And I'm sorry we don't have more time to debrief, but you know, the reality is opportunity awaits for conversation, listening, and building your teams. So bottom line is this, that, you know, piggybacking on what both Xavier and Carlos said, you know, if your employees are coming back into the workplace or if they've never left, their experience of the past 18 months provide a lot of opportunity to check in, to press the reset button, and to allow your employees to be heard. And I encourage you to do this as champions. Do this one-on-one. And also, if you are a department lead, do this in your one-on-ones with your employees. And also, you know, you can bring this to the team environment, just opening and making a space for people to be heard and to have some conversation and listen to one another. So next slide, please. So I'm offering you some prompts. I have a handout that that Lisa is going to go ahead and stick into the chat here, so we can make sure all you have access to it. But basically, it's opportunities for conversation. And what this handout is really offering some prompts of what you can say, you know, to just start a conversation. So on the first page is prompts for one-on-ones. And it's things like, you know, how are you hoping I can support you in reintegrating into the workplace? Or, you know, what type of support do you need now that you're 18 months into this pandemic and you've been working nonstop, you know, in the workplace? How are you feeling about coming back into the workplace for those who are coming back? What is your plan for self-care at work? And for those who have never left the workplace, what have you been doing for self-care, and what would you like to do differently, and how can I support you? And, you know, champions, this is an amazing opportunity for you to get information from the employees in your department and to be able to communicate that back to your champion coordinators, so they can help you decide what types of things you can bring into the workplace to support your employees. On the second page, we have the prompts for group meetings. And those are questions that you might like to pose to groups. And again, it really is around, a lot of it is about, you know, how can people be supported? What do you need to rebuild as a team? Or what do we need to do to ensure that we're doing self-care at work and supporting one another? So it's not all on the leaders, it's not all on the champions, but it really is about creating a culture of caring for one another. And that brings me back to the idea of our stress first aid workshop. So I'm going to leave you with those prompts, and our time has been quick, but I hope you've gotten some wonderful information today. I certainly know you did get wonderful information from Irene and Lisa, and thank you for your participation.